This is Charter Local Edition. My name is Brad Pomerance. We are coming to you from the nation's capital. We are inside the nation's capital, and we are joined by Dr. Phil Rowe. He is a member of the U.S. Congress representing the beautiful state of Tennessee, and I'm very glad you're here because you are a doctor.
Thanks,
an
Brad.
OBGYN. And so I want to talk to you about healthcare reform. I understand that you have had some concerns about the Affordable Care Act, about, as we know, Obamacare. Let's focus first on premiums. What can you tell us about premiums? Because we look at premiums and whether they're going up or down. It depends what state you're in, what city you're in, what plan you picked. What do you know, sir?
Well, if you look at the premise of the Affordable Care Act, which was to lower cost and increase access, no one could argue with that. I mean, that's what I got myself elected to Congress to help address.
Right.
The problem with it hasn't done that. And if you look in our state of Tennessee, and I don't know about a lot of other states, but in the exchanges in Tennessee, the rates are going to go up 36 or 38%.
It's so interesting you mentioned that because I was looking at some stats, and in Nashville, for example, rates are supposed to go up 16%, but in Denver, which is not that far from you, rates are going down 9%. So there's this kind of confusion and frustration. You know, why is it Nashville's getting hit, but Denver's not?
What happened was it depends on the selection of the pool that you're actually insuring. What the Affordable Care Act was based on were a lot of young people coming into that pool.
Right.
And a lot less young people came into that pool. Let me give you an example.
Please.
I went last Friday to get my oil changed.
Okay.
Congressmen actually go get their oil changed.
They do.
Like
they
other
get called
people.
for jury duty to boot.
Yeah,
right.
and you get things like that. Well, anyway, I go, and the fellow Tim who changes the oil in my vehicle, and you get your car washed and so forth there. I talked to Tim, and he couldn't afford, even with the subsidy, he could not afford the $300 a month that his premium was going to be. He's 35 years old. He covered his child through Cover Tennessee, an SCHIP program, a state children's health insurance program, but he couldn't afford it. You're going to find a lot of young people, almost 2 million of them, that did not sign up. What we also found in Tennessee was that the above 55 age did sign up and consumed a lot more health care, and that's why the premiums went up.
I want to ask you about others that are not covered and those that could be eligible for Medicaid. We know that your governor in Tennessee had looked towards accepting the Medicaid expansion in some form. Many Republican governors have looked at it and tried to create a public-private partnership or whatever it may be. Ultimately, the Tennessee State Senate, I know you're in Congress, but they opted against. And so what's your sense about the expansion? Because Republicans are starting to look at it in the states and saying, maybe we should try to make this work.
You know, I think what we're going to find in Tennessee is a unique situation because of our failed TennCare program. We tried over 20 years ago to reform the Medicaid program, and it was a colossal failure. And what happened for a lot of those senators and representatives that are still in the House, we had to cut a lot of people from the rolls, and that was extremely hard to do. And I think a lot of people were burned by that experience. And the other thing that the state's concerned with is how much federal control. Look, I think if you just block granted the states some money, and that's what Republicans want to do. Look, I trust our governor. We've got a great, terrific governor. And I know the Lieutenant Governor, Ron Ramsey, is a very close personal friend. If we block granted that money to the states, said, Tennessee, you help insure your uninsured people. We did that before with Cover Tennessee, a very good program that had 25,000 Tennesseans covered. They lost their insurance because, remember, the Affordable Care Act says you have to buy 10 essential health benefits, whether you need them or not. If you're 60 years old, you don't need pediatric dental coverage.
So there are folks that are looking at the expansion and looking for creative ways, like you've described. Are block grants something that this administration would consider? Because you need a waiver technically. But look, I think Indiana got a waiver to expand. I mean, the Republican states are getting waivers.
Yeah, I think a waiver would be required. I think definitely would be, but I can't speak for the administration. They haven't been that flexible, but I think certainly block granting would work. You take a state like Tennessee, maybe another state wouldn't want to do that. They'd want to take the current program. The other angst that I think people have at the state level is that the first 3 years, it pays 100%. The problem with it is we don't know how much Congress could change that percentage, and they're worried about getting a lot of people on that and then getting stuck.
At this stage, it's supposed to go down to 90% and then 80%, but you just said it. There could be a concern about how much states will have to cover. I want to speak with you also about drug costs. I'm the son of a pharmacist, so I know a little bit about drugs.
You hear a lot about it.
I hear a lot about it. And so I guess there's this drug that has become very popular called Sovaldi for Hep C. It's really a wonder drug from what I understand, but it's incredibly expensive. And I understand that one drug is causing premium spikes because it's so darn expensive. And so it begs the question about drug costs. Is there something that can be done to try to avoid these premium spikes in or out of exchanges when you have these wonder drugs hit the market and be incredibly expensive?
You're gonna, you hit a really great. That is a dilemma we've had forever.
Okay.
And here you have, as a physician, let's say you come in to see me and you have hepatitis C.
Right.
I have an extremely expensive drug I can treat you with. Or before that, I had no drug, and you had to face chronic liver failure, a liver transplant, all those. And we can essentially cure hepatitis C now.
Right.
The problem is we have an expensive cost, but competition is going to help bring that down. And we'll figure out how to do that, because I think in the long run, this drug is going to save money.
Right.
And,
right.
And
Presumably.
I think it will. I think when you look at a liver transplant, all the chemicals and drugs are required for suppression over long periods of time, and just going through that, that's a big operation.
As you may know, California recently, through their exchange, they have their own exchange, set a cap on drugs in terms of how much an insured must pay out per month. Is that an approach that should be taken?
Well, what we've done, one of the reasons I think you're seeing problems is you have too much government intervention. In other words, we don't have a free market system in healthcare. Almost all the prices are set by what Medicare pays. Everything pings off what Medicare pays. Medicaid pays a percentage of Medicare. The private insurers pay a percentage of Medicare. So I think we've set the cost. I think that's been a problem. And one of the things I don't want to see happen is this incredible innovation that we've had, new drugs like Sovaldi and others that have come out that are literally game-changing for patients out there.
I want to ask you about Medicare, because I think it's hard to deny that what happened recently in Congress with the parties coming together to fix the Medicare reimbursement situation was nothing short of awe-inspiring. It's the type of bipartisanship that makes Americans smile. Is there, I don't know where you were on that question, but be that as it may, is that a model that can be adopted to fix the issues with Obamacare? Because whether you like it or not, we all know they need to have fixes.
Well, let me just use a Southern expression.
Please.
I was slap dab in the middle of all that.
Oh, I'm sure, literally.
I co-chair the Doctors Caucus.
Oh, so you know.
And the way this process worked was, and you are correct, it is a model. Along with the VA bill that we passed last year was another model.
Yes.
Both sides got in the room and worked out. Here's how we did this. We got the Energy and Commerce Committee and the Ways and Means Committee. Those were the committees of jurisdiction. We got the Republican and Democrat staff together, and we said, okay, what do we agree on?
Right.
We need to get this problem fixed. How do we get there? And so for 3 years, we worked. When they would get a policy, they would bring it to the Doctors Caucus. We would say no. We brought in all the stakeholders, over 25 medical groups, and let them have input. We listened to everybody. And that vote was a voice vote out of Ways and Means, Energy and Commerce, and Ways and Means. 100% of the people voted.
So in our final moments, can we use that as a model to fix what needs to be fixed for the Affordable Care Act?
It's the only model that will work. And I've written a bill. I'm going to go talk about this afternoon.
Right. Yes.
Later.
And you'll come back. We'll talk about it.
We'll come back and talk about it later. But I think the answer is yes. That is the model that you need to use to help fix things here. And it's a shame it's not used more.
His name is Dr. Phil Rowe. He is an obstetrician gynecologist, but he's now a member of the United States Congress representing the beautiful state of Tennessee. My name is Brad Pomerance. We thank you so much for joining us on Charter Local.